Hi, my name is Shawn Joshi, and I'm an MD-PhD student at Drexel University in biomedical engineering, focusing on assisted devices and portable brain imaging. And now I've started to explore a little bit into social robotics. This clip from Scrubs shows a very common problem that plagues the healthcare system.
Again?
Says the bypass doc, nothing but salads.
Look, it was an accident. My flashlight didn't have any batteries.
Son, have you used drugs in the last 48 hours?
Oh, no, sir. Never use drugs.
Because this shot you're about to get could kill you if it's mixed with narcotics.
Oh, drugs, yes, sir, all the time.
Oftentimes, patients are unwilling to tell the truth regarding their symptoms and their problems. But honesty from the patient is essential to get the best care. Unfortunately, many patients are unwilling to tell private information for fear of negative judgment and embarrassment. Accurate information regarding psychiatric history, sexual health, physical abuse, and addiction can be crucial for healthcare decision-making. So this leads us to the first problem, where patients may withhold information. The second problem details that doctors are humans and are therefore prone to implicit bias. It is commonly known that Black women are not believed when they describe pain, and this has led to a racial gap within maternal mortality. This leads us to a solution that can offer an impartial medium, like questionnaires, but with a more back-and-forth interview process, like virtual agents. Although because building rapport between the doctor and the patient is important, we then ask, can a physical robot improve the medical interview process with reduced stress and increased trust with information disclosure? And secondly, can the use of a robot reduce some of the physician workload burden to allow them for flexibility and focus in their care? We've designed an experiment that will compare a typical medical interview with a physician to a robot-mediated interview. Some of the patients will be aware that a physician is interviewing through the robot, and the other group will believe that the robot is fully autonomous. We can then compare their stress and information through facial analysis, electrodermal sensors, and other measures. We will be looking at both physician and patient outcomes, and hypothesize that robot-mediated interviews will lead to increased trust with more information disclosure and reduce the physician workload. This could fundamentally change the doctor-patient relationship and even reduce healthcare costs. Already, because of the coronavirus pandemic, doctors are using telemedicine machines to monitor patients, but also stay safe from the virus. Maybe patients will even be more honest with physicians, telling them their symptoms, even if they fear being quarantined. So I really do believe that in the future, we'll move from just a current system with just a human physician as the doctor to in the near future, a combination human-machine teaming to eventually the frontier where we'll be interviewed specifically through robotics. Thank you for your attention, and if you have any questions, feel free to contact me.